Glad to have you back. Stakeholders in the health sector are seeking immediate legislative reforms and increased funding to strengthen Nigeria's public health security, emergency preparedness and response plans. This was disclosed in Abuja during a high-level stakeholders dialogue on strengthening Nigeria's emergency preparedness and response through legislative reforms. And our correspondent, Ene Anthony, has the details.
Speaking at the event put together by the National Assembly Committee on Primary Health Care and Disease Control, with support from the Legislative Initiative for Sustainable Development and Global Health Advocacy Incubator, the Coordinator Minister of Health and Social Welfare, Professor Mohammed Ali Pate, emphasized the country's need for robust finances to tackle disease outbreaks.
Globally, there are contingent financing mechanisms in place. So you need some resources that is provided as a contingent financing that you can draw down when there's a crisis, even if there's a threshold. Let's say resources available to NCDC if there's a public health emergency declared in Nigeria because you cannot plan for the crisis that will happen in a few months' time. It may happen or it may not happen. But if it happens and you are not prepared and you don't have the resources, then you are in deep trouble.
The chairman of the Senate Committee on Primary Health Care and Disease Control, Ibrahim Lamido, who was represented by the committee's deputy chairman, Tony Nwoye, said Nigeria needs to confront the pressing need for robust public health emergency responses and legislative reforms.
We should engage stakeholders in developing evidence-based legislative reforms, allocate sufficient resources and funding for public health initiatives, support research and innovation in healthcare systems.
Also speaking, the Director General of the Nigeria Center for Disease Control, NCDC, Dr. Jide Idris, highlighted the pivotal role of legislative action in ensuring a resilient health system for Nigeria.
It's not only when disease occurs you start thinking of this. These things are something you have to be ready. So when this happens, you move. And that's why legislation is key. The legislative will give you more resources. They provide this. So what we're talking about, emergency health bill. Like without that bill, we don't have bill now. You have an emergency. You may not have enough money to even operate.
So today we are talking about strengthening the emergency response. The role of the legislators. They have a very key role to make, as said earlier, in terms of identifying what are the critical gaps and the review of existing laws.
The Public Health Emergency Bill was passed by the last National Assembly. Unfortunately, despite its passage, it was not signed into the law because after passage by the National Assembly, the National Assembly bureaucracy did not forward it to the president, the new president, before the time refused. So we are here now to get the new National Assembly, General Assembly, to repass that law and the president to sign.
Earlier in his presentation, the chairman of the Senate Committee on Health in the 9th Assembly, Dr. Ibrahim Oloriegbe, explained that the Public Health Emergency Bill has not been transmitted to the President for assent, while the NCDC Act 2018 Amendment Bill stopped at the second reading level at the Senate and the first reading in the House of Representatives. Ene Anthony, STV News.